a show that tackles the big issues affecting the BVI and the rest of the Caribbean. Searches for answers to today's big questions and gives viewers a unique perspective on developing stories. Follow the big story with me, Kathy Richards, only on GTV. This show is brought to you by the National Bank of the Virgin Islands, Cyril B. Ramney Tertola Pier Park, and Digicel. Sign up for Digicel Plus Home Light bundles, faster internet, movies, and sports. This October, the Caribbean unites in the BVI, from Trinidad's spice to Jamaica's vibes. Guyana, St. Lucia, Barbados, and the heart of the BVI. One stage, one flavor. Top chef, mixologists, and connoisseurs bring a showdown of taste and culture. October 17 through 19, the Village K and Rhythm and Sands Food, Wine, and Rum Festival. Friday kicks off with a tasting, gourmet bites, and live entertainment. Saturday features cooking workshops, showcases, Caribbean jazz, and the junior chef battle, ending with the fish fest. Sunday closes with a champagne brunch, chef competition, fireworks, and a cultural finale. 3 unforgettable days of food, wine, rum, and island vibes in the BVI. On this edition of The Big Story, on Friday, October 3, 2025, the Wellness Center celebrated its latest expansion with the official opening of a state-of-the-art vision clinic. The milestone was marked by a ribbon-cutting ceremony symbolizing the beginning of a new chapter in care. I had the opportunity to sit down with the founder and director of the Wellness Center, Dr. Michael Turnbull, together with the head of the vision clinic, to discuss a key component of this development.
1, 2, 3.
Dr. Michael Turnbull, it's always a pleasure sitting and having simple conversations with you. We talk about so many different things when it comes to our health and our wellness. You're taking wellness to another level. Today, October 3, very, very significant to you. You're celebrating 3.
Yes.
3, tell us.
We're celebrating 3 things. October 3rd is the birth of our twins. My wife and I, who's now the president and CEO of the Black Point Group, which the Wellness Center Clinics falls under. We have our doctor, optometrist, Dr. Romanis, who's here joining us. And I wanted to take this special time, because we're always community focused, to say some of the community outreach that we're going to be able to offer to schools, seniors, and people who are not able to come out. So our outreach is going to help people not only live better, but see better and do preventative health care. And this is our investment in terms of outreach. And these 2 pieces of equipment, if you remember a couple months ago, that they had persons who come in and had people lined up to be able to get their eyes screened mobily. We made the investment because we believe in community partnership, being able to do preventative care in the schools and wherever we're welcome, in the churches, in the senior facilities. And we'll be doing this with our optometrists seasonally to be able to bring proper health care. So our doc could better explain what these machines are. Dr. Romanis is our optometrist with over 26 years of experience. He is not only an optometrist, but he's proficient in glazing and making the frames and the lenses that that we do here at the Wellness Center from start to finish for our whole digital equipment. But these, we want to highlight what we're able to do here.
Yeah, we have here the equipment for community eye care programs. And one of the equipment we have here is the digital vision screener system, which we can use to capture the refractive error especially for children. If you bring a baby in our clinic, even if you bring a baby of 1 week to our clinic, we have this equipment here that we can be able to know the refractive error or the refractive status of that individual. And if we have people who are not disposed to be able to communicate with us and talk to us about their refraction, we can be able to use this equipment to get the refractive status of that individual without even the person talking to us. And so we also have this digital retina camera, which we can use in community level to screen people, especially those that have diabetes. We can be able to look into their eyes and know if they have diabetic retinopathy, or maybe if people that have hypertension, we can check the inside of their eyes to know if they have hypertensive retinopathy. We can check to also know if somebody has glaucoma. And so we have this equipment that we can use to screen people. We can be able to screen hundreds of people in a day with some of these equipments under the community eye health programs. And we're able to know those. We can refer to the clinic for more comprehensive tests if we detect any problem in their eye. So we are very much equipped both at the clinical level and at the community level to provide the best eye care, best digital eye care services and modern eye care services in our time.
Yes.
What this sounds like is that you're going to be expanding resource-wise
Yes.
in this. We have Doc, but you have other eye specialists.
Well, we have, and Doc has been really gracious about being able to train young professionals. We have some pre-med students. We have people who are going away to school who could help facilitate and work as eye techs. So we're going through a training with some of our young people. And we want to say, if you're interested in careers, if you're interested in doing something new, you maybe never knew that there's a profession about glazing glasses and making frames and making lenses. You know, you're maybe good with your hands, but these allow us to be able to expand but serve our community, and not for a cost, to be able to give back. Because giving back is how we as a people have built where we are, and we are stronger together. So this is an opportunity for us to give back community programs, and this investment was made not because of money, but we want to be able to serve people who are maybe not able to come to us, and do a couple hundred, as Doc said, in one day, and let you know maybe you should follow up with your eye care.
Okay, Doc, this is happening at a time when we're crying that the world's economy is tight, it's hard, but yet you were able to make an investment this significant. Give us some words of wisdom that went into this.
I will say, as Dr. Romanos is ordained as I am, we don't operate on the world capital, we operate on kingdom principles.
Yes.
We use faith, investment, good community resources to be able to power through. And you take your time and be patient. So this is not built on how the economy is going, it's built on the need of the people.
Yes.
And when you have great community partners, like our banking partners, National Health Insurance, we have a great team of people, you push forward. And so our partners from Florida to Europe to China, for the people who are all here, we've come all the way to Nigeria, and his wife as well, who's an optometrist as well in Nigeria, has been able to help us. He has 5 children now going off to medical school, from radiology to pediatrics to optometry. So we have a network of people. But if you ask why you do it, sometimes your dreams have to be bigger than the reality that you're currently in. Yes. And that's what helps change your reality. It's not easy. It takes a lot of prayers, sacrifice, long nights. Sometimes you don't know where you're going to go. But I want to encourage people to keep dreaming. Like, it matters, because some other child, somebody else will see what you've done and be able to be inspired. And that's how we make the world a better place.
And we talk about legacy, and this being launched on the birthday of your twin.
Yeah, it's about family, about passing on, so they could be better. Doc wants his children who come as doctors be better than him, and the same as us. And we believe in replication leadership, so we could be able. Everyone has a chance to be able to live well, regardless of where you are, who you are, your economic background, and that's why our frames start as low as $49, because we want people to be able to get access.
Yes.
So the coverage that covers from NHI, you're going to be able to use a significant portion of that to cover your eye care. So it's not a burden on you, and you can access our services.
Awesome. All right. Congratulations again to you and the team. And I know we can expect something else from you in the very near future.
Thank you. Thank you so much to JTV for always providing a platform. A bit of history, if you may have forgot, my first interview ever moving back home was on JTV with my brother Edjuenka, and your whole team, your staff, and you as well behind the camera and interviewing Ms. Richards. I just want to thank you guys so much for always being a partner for good.
Thank you for joining us for this edition of The Big Story. I am Kathy Richards. This October, the Caribbean unites in the BVI, from Trinidad's spice to Jamaica's vibes. Guyana, St. Lucia, Barbados, and the heart of the BVI. One stage, one flavor. Top chef mixologists and connoisseurs bring a showdown of taste and culture. October 17 through 19, the Village K and Rhythm and Sands Food, Wine, and Rum Festival. Friday kicks off with a tasting, gourmet bites, and live entertainment. Saturday features cooking workshops, showcases, Caribbean jazz, and the junior chef battle, ending with the fish fete. Sunday closes with a champagne brunch, chef competition, fireworks, and a cultural finale. 3 unforgettable days of food, wine, rum, and island vibes in the BVI.